My name is Dominic Goodbuffalo, and I am one of the parent advocates and grant coordinators for Pacer Center, and specifically work on the SPDIC grant. I am Oglala Lakota Sioux from the Pine Ridge, South Dakota.
My name is Hassan Samantar. I'm one of the multicultural parent advocates at Pacer. I work with East African communities, predominantly the Somali families.
My name is Jesus Villaseñor. I'm originally from Mexico, and for 28 years I've been advocating for Spanish-speaking families at Pacer Center.
Hi, my name is Joshua. I was originally from Laos.
Probably just our values in nature, traditional customs, things like that. Our values in medicine use in nature, and so kind of just like sage, sweetgrass, tobacco, and cedar. Just a lot of those uses. We usually use those medicines for spiritual purposes, and so a lot of our traditions are in that. And so a lot of healthcare providers can see that as kind of a negative, but usually in our culture community it's seen positive. And so
there's a lot of diversity in the Latino culture, so early on I learned that every family is different. Having said that, and without trying to stereotype my culture, there are some things that may be kind of general. We do tend to have a close-knit family.
The countries that we came from, it's the healthcare and education system is vastly different than in this country. We may not be used to hearing some of the terminologies, some of the practices, some of the aspects of the healthcare system. It's something that is new to us and we're not familiar with.
In a Hmong family or community, we believe the spirits dominate all aspects of human life and everything on earth. Illness is perceived to be caused by one individual's soul. For that reason, we engage in shamanistic ritual to help maintain and restore health.
Microaggressions in healthcare today, a lot of distrust that specifically in the American Indian community, there's a lot of distrust. Healthcare is not investing specifically in like the Native community, for example,
Many of the families that I advocate for live under the poverty level, so that affects many times the access that they have to healthcare. So culturally speaking, we don't engage too much in preventative medicine. We tend to leave things until they become a bigger problem when it comes to our health. Access to healthcare doesn't come easy for our families, many times because of economic reasons, other times because of undocumented status that creates this obstacle or fear to have a close relationship with the service providers. Language is also a challenge, so we need to make sure that that doctors are providing with decent interpretation services.
For instance, one of the pitfall, if you will, that I see a lot of the families from our community, we're not familiar with a preventive medicine. We typically see doctors or physicians only when someone is very sick. And consequently, a lot of times families might go to resort going into the emergency rooms instead of going to their doctors and their physicians. I think the most obvious is the language barriers, and it's not only the ability of speaking the language English, also the terminologies, the different field of a medicine in this country. For instance, back in our countries, we didn't have the psychiatric field. We didn't have a psychology field.
Many Hmong families still lack the ability to understand the concept of human body and illness, especially when they have never encountered them before. Mental health issues and disability are even more complicated than that. They often see them as spiritual issue and would seek help from the spiritual leader before seeking help from medical professionals.
Has their healthcare provider done in their community to invest more into their, specifically in the American Indian community? And so do you see them at events? Do you see them in the community? Do you see them in, just every day? And so are they being open? Are they being trustworthy, honest? Simple virtues like that can go a long way with not just Native families, but families in general. So
opening the channel for communication. We do value a lot the relationship we have with our physician, with professionals in general, but particularly with our physician, more than even the services that families are getting for their kids or for themselves.
Encourage them to pursue traditional healing that matter to them while you provide a medical diagnosis, and you can support them. Having a basic knowledge of Hmong traditions is an essential part of taking care of the healthcare needs.